Welcome to Strong Health Way. I'm Dr. David Mitchell. I'm 60 years old, and for more than 3 decades, I've dedicated my life to walking alongside people over 50. Today, I want to share something that even shocked me. There are routine medical tests that almost all of us have had that seem harmless, but can actually increase your risk of stroke overnight. I know that sounds hard to believe, but science shows us this: when the body is pushed too far or tested at the wrong time, the brain is under enormous stress. And once we hit 60, our brain no longer recovers as quickly as it did when we were young. What we often think of as a routine checkup can sometimes turn into a double-edged sword. Now, don't get me wrong, tests are not bad. In fact, many of them save millions of lives every year. But here's the problem: more is not always better. Especially as we get older, one small mistake can cost us our health for the rest of our lives. That's why if you or your loved ones are past 60, today's video could be crucial. We're going to uncover 7 medical tests you need to be very careful with, and most importantly, how to protect your brain and keep your mind sharp. Every year, millions of people over 60 walk into a clinic trusting that regular checkups will give them peace of mind. And yes, many of those tests are necessary. But here's the hidden truth: some of these seemingly harmless tests can put sudden pressure on the heart and blood vessels. When that happens, blood pressure can spike, blood flow to the brain gets disrupted, and the risk of stroke can appear overnight. I know that sounds scary, but with more than 30 years of experience working with older patients, I've seen it happen. The key here is not to live in fear, but to make wise choices. Not every test is dangerous, but timing and individual condition matter. In today's video, I'll share with you the 7 tests seniors should approach with caution and how to protect your brain and safeguard your clarity of mind. If you're already over 60, type the number 1 in the comments. If not, type 0. And don't forget to hit that subscribe button on Strong Health Way so you won't miss the essential health knowledge that can keep your golden years strong and vibrant. Let's start with the first test, one that I'm sure many of you have heard of and maybe even gone through yourself: the CT scan with contrast dye. Sounds pretty routine, right? Most people think, well, the dye just helps the image look clearer so the doctor can diagnose better. But here's the truth for people over 60: this test can carry serious risks. When that contrast dye enters the body, it can cause your blood pressure to spike in just a short period of time. Now imagine the blood vessels in your brain like old water pipes. After 60 years of use, they're not as flexible as they used to be. So when pressure suddenly rises, those vessels can tighten, crack, or even rupture. And that's exactly when a stroke can strike without warning. Recent medical studies show that in older adults, especially those with conditions like high blood pressure, heart disease, or kidney problems, the risk of vascular complications increases significantly within 72 hours after a contrast CT scan. I've personally seen patients who went in for what seemed like a safe routine test, only to end up back in the hospital days later with a stroke or heart issue. So what should you do? This doesn't mean you should never have a CT scan. Sometimes it's absolutely necessary. But the key is always ask your doctor before agreeing. Simple questions like, can this scan be done without contrast? Or are there safer alternatives like ultrasound? Or a non-contrast to CT can protect you in a big way. Here's the bottom line: the older we get, the more sensitive our bodies become. What we could easily handle 20 or 30 years ago may now turn into a dangerous burden. That's why before every medical decision, pause for a moment, ask the right questions, and make sure you get a clear explanation from your doctor. Sometimes one wise choice is all it takes to prevent a major health crisis. Earlier, I shared with you some tests that seem harmless, but can quietly trigger serious health storms after age 60. Now let's move on to another common one: the MRI with contrast injection, also known as gadolinium. When people hear MRI, the first reaction is usually, oh, this must be safer than a CT scan, right? And yes, it's true, MRI doesn't use radiation. But once contrast dye is injected, the story changes. In younger people, the kidneys can easily filter out gadolinium. But after 60, kidney function often slows down. That means this contrast can linger in your brain, in your tissues, in your organs. I've had patients come back to me just days after their MRI saying, "Doctor, I feel dizzy. My memory feels foggy, and I even stumbled over my words like I just had a mini stroke." And they were right to be concerned. Studies have shown that gadolinium can deposit in brain tissue, Not everyone will feel symptoms, but in older adults, dizziness, confusion, or loss of balance can be dangerous. Because let's be honest, at this age, even a single fall can change your whole life. That's why I always remind my patients before getting an MRI with contrast, ask your doctor to check your kidney function, specifically your GFR score. If your kidneys aren't strong enough, it may be wiser to choose another option. Sometimes an ultrasound or even a non-contrast MRI can provide enough information without putting your brain and kidneys at risk. Have you ever had that feeling where after a medical test, instead of feeling reassured, you walked away more tired, more sluggish, and less sharp? One of my patients, Helen, 67 years old, once told me, "I thought MRIs were completely safe. But after mine, I felt like a different person for days. I even forgot my lunch date with my daughter." That's not what medical testing is supposed to do to us. I'm not sharing this to scare you, but to remind you after 60, our bodies are like vintage clocks. They still work, but every gear needs care and gentle handling. Don't let a rushed medical decision cost you your clarity, your memory, or your independence. An MRI with contrast is just one example. Up next, I'll share another very common test that, if not carefully considered, can quietly become the trigger for a stroke in older adults. The second test I want to share with you today is the stress test, the treadmill exercise test. Now, at first, it might sound harmless. Some people even think of it like a light workout at the doctor's office. But for those over 60, especially if you have heart problems, this test can be like striking a match over dry straw. I've seen many patients who, just a few minutes into running or fast walking on the treadmill, suddenly experience irregular heartbeats, or their blood pressure shoots up to dangerous levels. On the surface, it looks like the body is just testing its limits. But in reality, the heart is being forced to push far beyond what it can handle. And when the heart is overloaded, blood surges to the brain, and those fragile blood vessels, already worn thin after decades, can burst or tighten without warning. That's how a stroke can happen right after what seemed like an innocent test. One U.S. study found that in older patients with a history of coronary artery disease, exercise-based stress tests actually doubled the risk of heart complications within 48 hours. Now, this doesn't mean everyone is in danger, but it's a powerful reminder. Ing is like driving an old car. It can still run, but you need to handle it carefully, and sudden acceleration is never a good idea. So what's the safer alternative? Instead of forcing the body to run on a treadmill, modern medicine offers gentler options that are just as effective. For example, there's the pharmacological stress test, where doctors use special medication to simulate the heart under stress while you simply lie down. Or even simpler, a resting echocardiogram can reveal plenty of important information about your heart's function without putting your body at unnecessary risk. The key message here is this: never ignore the warning signs your body gives you. If you have a history of high blood pressure, diabetes, coronary artery disease, or even if you just feel uneasy about stepping on that treadmill, speak up to your doctor. Remember, health checks aren't meant to challenge your endurance. They're meant to protect your life. One of the next tests I really want you to pay close attention to is endoscopy with sedation, whether it's for the stomach, colon, or esophagus. It's a very common procedure, and at a certain age, almost all of us are told we should get it. But here's the thing: the real danger often isn't the scope itself. It's the sedatives used during the procedure. Think about it like this: at age 30 or 40, our bodies handle sedatives pretty well. Heart rate and blood pressure bounce back quickly. But after 60, many of us are already on blood thinners, blood pressure medications, or heart drugs. Mix those with sedatives and you've got the potential for a very dangerous chain reaction. I've seen it happen. One patient of mine went in for a short endoscopy. Everything seemed fine until suddenly his blood pressure crashed, his brain didn't get enough oxygen, and within minutes he showed signs of a mini stroke. Medical studies confirm what I've witnessed in older adults. Blood vessels are less elastic. So when sedatives slow the heart and drop blood pressure, the brain doesn't get the blood it needs. That's the perfect setup for a tiny clot to trigger a mini stroke. And one mini stroke today could easily be a warning sign for a major stroke tomorrow. Take Robert, a 72-year-old patient of mine. He told me, "Doctor, I thought it was just a routine endoscopy. But when I woke up, my head was spinning. My hands were shaking. I couldn't even hold a spoon." Thankfully, he recovered, but his story drove home the point. No procedure is 100% risk-free once you're past 60. So what can we do? My advice is simple. Always have an honest conversation with your doctor beforehand. Ask, can this be done without deep sedation or is there a lighter option? Sometimes just a local anesthetic or a very mild sedative is enough to get through the procedure safely without putting your heart and brain at unnecessary risk. Caring for your health at this stage of life is like guiding a boat across a calm lake. One small wave can throw everything off balance. We don't need to live in fear, but we do need to stay sharp and weigh every medical decision carefully. And coming up next, I'll share with you another test, something that looks completely routine, but can actually be a hidden health trap for older adults. Another test I often get asked about, and I'm sure many of you have gone through it, is the routine blood test. Sounds simple, right? We all know the drill. Walk into the hospital, roll up your sleeve, let the nurse draw a few tubes of blood, and walk out thinking we've just had a full health checkup. But for people over 60, things aren't always that simple. Picture this: at this age, the body is like a candle that's burned more than halfway. The flame is still burning, but the wax is running low. When blood is drawn repeatedly, even just a small amount, it can upset that delicate balance. And if you're on blood thinners, which so many older adults are, the risks go up. Your blood doesn't clot as easily, your blood vessels are more fragile, and if too much blood is taken, your blood pressure can suddenly drop. The brain doesn't get enough oxygen, and that can lead to dizziness, loss of balance, or even a mini stroke. I remember one patient, Margaret, 68 years old. She was fairly healthy with just a history of high blood pressure. But in 2 weeks, she had 4 blood tests as part of a so-called comprehensive checkup package. After the 4th one, she told me, "Doctor, I walked out of the hospital feeling lightheaded, the room spinning, and I almost collapsed right there in the hallway." Thankfully, she didn't suffer any serious complications, but that was a wake-up call. Science has also shown that frequent blood draws in seniors can temporarily lower red blood cell counts, almost like the body has just gone through a mild blood loss. And in a system that's already more fragile, even a small change can trigger a big problem. So what's the solution? The first thing I always tell my patients: only do the tests that are truly necessary. Signing up for the whole package doesn't automatically mean better care. In fact, unnecessary tests can drain your body, increase your risks, and add no real value. Always talk to your doctor and ask, why do I need this test? Will the results actually change my treatment? If there's no clear answer, chances are you don't really need it. And let me ask you, have you ever felt unusually tired or dizzy after a blood test? If you have, don't just brush it off as normal. That could be your body sending you an important message. And that's just one piece of the bigger picture. Up next, I'll share with you another test that may look safe and familiar, but once you're over 60, it could quietly challenge both your heart and your brain. The next thing I wanted to share with you might sound simple, but it can have a powerful impact on your brain health, and that's the heart ultrasound. You know, a lot of people think of an ultrasound as just a safe, harmless test, almost like taking a gentle snapshot of the heart so the doctor can take a look. But the truth is, if we stop at just a quick ultrasound, we may miss something critical: those tiny blood clots that quietly form inside the heart. I often call them invisible travelers. They can sit there for weeks without making a sound, and then suddenly break free, drift along the bloodstream, and head straight for the brain. And all it takes is one of them getting stuck in a brain artery for a silent stroke to happen. I remember one of my patients, Eleanor, 72 years old. She was healthy, no real symptoms at all. She had an ultrasound and everything came back normal. But a few months later, she started having these little moments of confusion, like forgetting where she had just placed her keys. When we looked closer, it turned out she had experienced a series of mini strokes caused by those tiny clots that the ultrasound alone couldn't catch. If she had been monitored with a 24-hour Holter test back then, we probably would have seen the warning signs early and prevented those events. So I want you to pause for a moment and ask yourself, when was the last time I had my heart checked? Am I sure a single ultrasound is enough? Because as we age, the heart and the brain are more connected than we realize. Protecting your heart isn't just about preventing a heart attack. It's also about protecting your memory, your clarity, and your daily independence. That's why if your doctor suggests a heart ultrasound, don't hesitate to ask, should I also have a 24-hour heart rhythm monitor? It's such a small step, but sometimes that little step can save you from a life-changing event. And in this journey to keep our brains healthy, every wise decision we make becomes a strong foundation for the years ahead. You see, even heart ultrasound, something we usually think of as very safe, has its limits. It's like looking into a large room through a tiny window. You catch a glimpse of some details, but the corners remain hidden. And sometimes those hidden corners are exactly where danger lies. This takes me back to a patient of mine, Mr. Robert, 73 years old. His heart ultrasound looked normal, but just a few months later, he suffered a mild stroke. When we checked again, we discovered the problem wasn't in the heart at all. It was in the highway carrying blood to the brain, the carotid artery. Now, a carotid ultrasound is simple and painless. You just place the probe on the neck and you can see how much narrowing is happening in the blood vessel. But here's the catch, it's a double-edged sword. I've seen many cases where the scans showed moderate narrowing, not too severe. Yet just because of that number on paper, patients were pushed into surgery. And they carried this constant fear. If I don't do the operation, I might have a stroke any day now. But the truth is different. Large studies show that for patients without clear symptoms, using medication and making lifestyle changes, healthy diet, gentle exercise, controlling blood pressure and cholesterol can be just as safe and sometimes even more effective long-term than surgery. That's why I always encourage my patients to ask one simple question before deciding: if narrowing is found, what's the actual treatment plan? Do I really need surgery? Because not every number on an ultrasound is a death sentence, and not every surgery is the only way out. Doesn't this sound familiar in life too? So often we rush to fix a problem right away when a calmer, more patient choice might actually lead to a better outcome. And when it comes to health, sometimes the greatest medicine is patience and clear thinking. You know, after so many years as a doctor, I've learned something important. Not every test brings peace of mind. In fact, sometimes it only plants more worry and even more risk, especially once we pass 60. At that stage, our bodies don't bounce back as quickly, and the brain, the command center of our entire life, becomes incredibly sensitive to even the smallest changes. I remember one patient, Mary, 68 years old. After a routine checkup, her doctor recommended more and more tests. She believed the more tests I do, the safer I'll be. But the truth was, one of those tests led to an unnecessary procedure, putting her at risk of complications. She told me later, "I wish I had asked more questions from the start." That's why my sincere advice to you is this: don't be afraid to ask your doctor. Speak up and say, is this test really necessary? Is there a safer option? Because your health isn't only about detecting disease early, it's also about avoiding the dangers of unnecessary interventions. I believe that health in our later years is really about balance, not living in fear, but also not ignoring risks. And sometimes wisdom in asking a simple question can protect you from a lifetime of consequences. My friend, today we've uncovered a powerful truth together. Not every test is essential, and sometimes too many tests can actually put your health in danger. After 60, the greatest treasure is not just adding more years to life, but making those years truly meaningful, safe, and peaceful. Please remember this: your health isn't only in the doctor's hands, it's in the smart choices you make for yourself. Ask questions, be cautious, and know that one timely decision can change the entire journey of aging. And if today's message resonated with you, help me spread it. Click the like button, share this video with friends your age, and don't forget to subscribe so we can continue walking this meaningful health journey together. Because you truly deserve a strong, wise, and peaceful older age.